Hello everyone, so let's grab yet another CT scan from the emergency and see what we get, because you guys know CT scans just don't report themselves. So I'm here with a CT scan of a female patient. She is 46 years of age and this is a lumbar spine CT scan. I have already downloaded the images. I'm just going to share my screen so you guys can see. This is supposed to be a lumbar spine, but it's really badly done. This is the wrong field of view, and this exam is all shaky and really low quality, but it is what it is. Let's see. It says she has lower back pain, so let's see if we can find a cause, a justification, a motive for such pain. Just go to, let's just zoom in and position it, and I'll just did a multiplannar reconstruction. See how shaky it is? Really shaking, it blurred. This is very upsetting, but what can you do? You just have to report whatever it is, no matter the quality. So, are you guys seeing it? Yep, you guys are seeing it. So let me just position it. Yeah, much better like that. Just drag it right here. So this is the axial view. This is the sagittal view, and as you guys can notice, as I go up and down on the axial view, I have a reference line right here on the sagittal, so I can properly call the vertebra by their names. So this is a lumbar spine. This is a quite young patient. There really isn't much to say here, but there are some features that could be painful and could be related to the patient's complaint. So let's see, right here on L4, L5, I can readily see there is a protruded disc. It's mild, but it is nonetheless protruded, and it does some mass effect. It causes a impression, a slight compression on the anterior surface of the thecal sac. And right here on L5S1 also there is a protruded disc behaving the same. Let's just go back a little and look for bone lesions on a bone window. No. Posterior arc components are fine. Maybe a tiny, very mild sign of arthrosis right here on the last lowermost segments. This is quite common. This is where it's supposed to begin. The aging process of the spine. I can say there's some hypertrophy and some sclerosis, maybe a few osteophytes, tiny osteophytes, so there is some sort of arthrosis just beginning to show up. Yep, tiny signs of arthrosis, nothing major. Still, this could be painful. There is some degree of hypotrophy and fat infiltration of perivertebral muscles. So you guys can see it's not supposed to be black like this, as black as subcutaneous fat. So this is fatty infiltration of these muscles right there. So this is quite common and usually related to chronic pain and chronic denervation. Maybe not in this case, but this patient is quite young. Still, I wouldn't be surprised if this gets worse. no matter the treatment. So, yep, no fractures. Disc spaces are really normal, they are reduced in height, so no surprise here because we have already two protruded discs. So this is mild degenerative disease and a few protrusions, bulging discs, mild arthrosis, and some hypertrophy of perivertebral muscles. So let's grab our template and start reporting, because this just won't report itself, unfortunately. So I have said here there is some tiny anterior osteophytes, which isn't true. So just get that. There is mild arthrosis of facet joints, reduced intrasomatic spaces, disc spaces, and there are two protruded discs on L4, L5 and L5S1. Yep. And hypertrophy of perivertebral muscles. Let's just summarize the report so it's much easier for the referring physician to read and be happy about it. So we are done, and of course if you enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click here and keep watching, and of course don't forget to hit that like button and consider subscribing to the channel.